morning, good afternoon, good evening. My name is Nurse Uche. I'm here once again, and with me is...
Hi, Nurse Angela. I'm sure you know my name already. How are you doing today?
Hello, I'm Nurse Elizabeth. I'm appearing for the first time, but I think you see more of my face. Okay, so currently we are in our sleep study room. We have 5 centers here in Abuja. We have 5 centers where we run the sleep study test. Today we're talking about the home-based sleep study, which I'll be demonstrating to you shortly. Okay, so I'll be demonstrating on how to use the home-based sleep study machine, and later my colleague will be talking about CPAP machine, that's continuous positive airway pressure. So this is the sleep study bag. It comes this way. You open the bag. This is the polysonography machine. It has other components as well in the bag. This is the oxygen cannula. This is the pulse oximeter cable. This is the charger. We also have a plaster in the bag to ensure you secure the pulse oximeter to your finger. I'll explain how to use that later. So this is the machine. I'm talking about how to use the machine. This is how the machine comes. It has ports where you attach the pulse oximeter cable and also the oxygen cannula. But firstly, you have to put it around your body. It has a band. You place it this way on the abdominal area. Then you just pass this one through this point. Okay, so you just pass it through this point, and it has an adhesive tape which you just secure in your body. You just have to be firm and comfortable, no need to be too tight. Next, I will open my oxygen cannula. We use a new one for each patient. I will connect it to this port. You just screw lightly. Then next, I'll wear it over my head. This is an adjustable tubing which helps you to adjust it over your head. You insert this tubing into your nose, then adjust the tubing behind for it to be firm on your head. Okay, so you attach the oxygen to the tubing into your nostrils this way. It has to pass over your ear. Then you put the adjustable tube behind, adjust it for it to secure on your head, just this way. So next, the cable for the pulse oximeter. It has a port. The port is here. It's designed in a way that you see the way it's going to fit in because of this here. So you just put it here. It's easy to put, just stay in place. Then you put it over any finger of your choice. You can actually use the adhesive plaster to ensure it's in place. So that whenever you have to turn while sleeping, it won't go off. Just this way. Just put on the machine this way. The on button is here. You see it. You put it on. Then you look at the screen. The video will be displayed on the screen. However, you have to ensure that the memory card is in place. If it's not in place, you'll see something like this. So please ensure the memory card is in place, because without it, we can't get the reading. So you observe for the parameters on the screen. Ensure that the pulse, the SpO2 is reading. I just inserted it now and it will come up. For you to know that it's reading, you see it here, and you also observe that this green light here is on. You can notice that maybe during your sleep, when you wake up, that the screen is blind. It's still reading as long as this green light is being turned on. So when you wake up in the morning, you put it off. First, the memory card already took the reading, so you disconnect Carefully, you adjust the tube behind your head and move the nasal cannula from your nose. You unscrew it, then you discard because you will not need this again. Then you take away the adhesive plaster for your fingers. Then this cable, move from this spot as well, and put into the bag. Then you remove this band from your abdominal area. You just fold it and put it into the bag. Then you bring it to the center where the IT personnel will interpret the results. We have different treatment modalities based on the outcome of the results, which we interpreted by our consultant, Dr. Folorunso Femi. So I will show you a sample of how the sleep study result looks like. This is a sample of what the home-based sleep study report looks like. The patient's name is here there, the dates. It dictates pulse wave, body movement, snoring, airflow, abdomen movement, saturated peripheral oxygen level, the pulse, body position. It shows all these details where after all the results is being gathered, it could actually be a normal study. It might be minor sleep apnea, moderate sleep apnea, or even severe sleep apnea. However, the consultant, Dr. Folorunso Femi, will review the results with the patient based on the findings. Okay, so I'll be answering some frequently asked questions.
Ms. Uche, a lot of people ask so much questions, maybe after watching this video or see this machine out there online. So we'll be glad to have you answer some of these questions that they are likely to ask. So Can you go to the bathroom with this machine?
Okay, actually, it depends on the patient. To avoid the machine being contaminated or falling down. But if you know you can be very careful, you can go with the bedroom to the bedroom it is. However, for safety reasons, you can actually drop it, disconnect it. When you come back, reconnect again. We will see that when we want to interpret the result. It doesn't interfere with the results.
All right, thank you so much. So Can you attach this machine on your body without your clothes on, or you can just attach it even with your clothes on?
Okay, the main aim of the test is for it to be comfortable, for us to get the perfect result. So it depends on you. You can attach to your body directly on your skin or with your clothes on. Whatever makes you comfortable is fine.
All right, so how do you know if the machine is actually working?
Okay, like I said, if you check the video, I showed you a point where that green light is on. The screen can go blank, but when you see that green light is on, it's actually recording, so you have nothing to worry about. So you can actually press that button in between two, but it's actually recording. You don't need to worry about it.
How tight can one make this machine on his or her body?
Okay, like I said earlier, we need it to be very comfortable. So just to make it firm and very comfortable. It doesn't need to be too tight or too loose, just firm and comfortable.
All right, so assuming the machine is on my body, how long do you think, or when is one required to remove this machine on his or her body?
Okay, just have 5 hours of sleep. After the 5 hours of sleep, you can have more than that, but at the minimum is 5 hours of sleep. Then you disconnect. You just put on the off button and video is completed.
All right, so when will the result be ready if this is being carried out?
Okay, here we give swift action, so the results can be ready within 24 to 48 hours. We have IT personnel that work around the clock, so within 24 to 48 hours the result will be ready, and the consultant will give you a comprehensive report on the sleep study results, which you can come and collect within that period of time.